was thinking about this program about whole health dentistry. It occurred to me that there are, if you're participating in this, then you're in some way seeing yourselves as participating in what we're calling whole health dentistry. And it occurred to me that there are a couple of hundred people who registered for this workshop, several hundred people who registered for this workshop, and there are probably that many definitions of what whole health dentistry is. There are probably that many variations on the theme of what whole health dentistry is. And everything from, some of you it's about having conversations with patients about their health, it's about having conversations with them about their diet, just informal conversations, or about their sleep habits. For some, it's about incorporating different modalities like testing or products or appliances, various forms of treatment that you're providing that is more broad-based than we've narrowly defined dentistry. For some of you, it's about including partners from other types of health professions, physical therapists or nutritionists or massage therapists. There's a wide range today of what we consider whole health dentistry. One of the things that occurs to me about that is that that's going to be our conversation tonight. And what I want you to know is this is for all of you, wherever you are on that spectrum of all of the things that you're doing. I hope that this program will be helpful for all of you, because to me, this is about the possibilities in whole health dentistry. This is about what all of the ways in which we can become more and more of that trusted advisor for our patients. And we're going to talk a lot about that, about how we move into that realm of relationship with our patients. And I wanted to introduce you to a friend of mine who I've asked to be with me here this evening, and that's Dr. Martha Rich. And Dr. Martha Rich and I do a program together every year that we call a team approach to whole health dentistry. It's a 2-day event that we have here in Seattle. It will be in November 4th and 5th this year in Seattle. And it's a 2-day event focused on a team approach to whole health dentistry. We call it expanding the standard of care. And the reason that I asked Martha to partner with me for that workshop, and that I asked for her to be with me tonight, is that what I know Martha to be someone who is seen by her patients as a trusted advisor. Yes, she fixes teeth. She does do some teeth fixing, but Martha and her team, all of the people who participate in Martha's practice, are seen by their patients as a resource for questions around health. It's a place where people feel safe to talk and ask about health on a broader sense than in a dental practice. And so one of the things I've asked Martha to do is, Martha is going to check the chat. She's going to monitor the chat room. So for those of you who have comments about anything that I'm talking about, or questions that come up as I'm talking, because I have some slides. I'm going to talk for a while with these slides. If there are questions that come up for you or comments that you want to make, feel free to go ahead and put things in the chat room. And since I can't walk and chew gum at the same time, Martha will be monitoring that chat room, and I will check in with her later in the program to get a sense of what she's getting from the group, because I really would like this to be a place of learning from each other. And there are so many of you in this room who have various experiences with this that I know it's going to be an exciting conversation to have. There's also, just if I can point out to you, a couple of other things where you can raise your hand, or different kinds of activities that you can tap in that I will probably ask you at some point to respond to. And again, Martha will be watching that for us, and I'll check in with her on on what's showing up around all of that. So this idea of going from fixer of teeth to trusted advisor, we don't have 2 days. We do a 2-day workshop, but we have an hour tonight. And so I want to be clear about what the expectations, what are those sort of reasonable expectations for this evening. And I have 3 things that I want to help you with this program. And the first is I want to help you help your patients see you as a true partner in health. I want to help you learn how to make better use also of what I see as a very powerful tool you already have in your practice that you're already using on a regular basis, but that you can use more effectively in your practice. And finally, I want to help you learn how to help your patients aspire to higher levels of health. Help them set goals that you can participate with them in accomplishing as part of your practice. For those of you who know me know that for a very long time, I have believed that our primary responsibility, no matter what our role is in a dental practice, whether I'm a hygienist scraping teeth, or whether I'm a dentist making tooth dust, or I'm an assistant sucking spit, or I'm fighting with insurance companies, whatever it is, our primary responsibility is to help patients make healthy choices. No matter what else we're doing, everything we do should have that focus of helping patients make healthy choices. That's our job. Now, I haven't always seen it that way. I tend to think I always said that, but I haven't always said that. The truth is, when I got out of dental hygiene school, I came out as I was told that I was a dental health educator. And this is sort of what I thought of when I thought of dental health education. I thought my job, really, my focus was really quite narrow, and it focused primarily around making sure people's teeth were clean. I didn't have a very broad perspective on what was possible through dentistry, on what the opportunities were that we have. Over time, my vision of that has tremendously expanded over time. That very narrow vision of oral health expanded, first of all, beyond clean teeth to alignment and occlusion, and to better understanding of the stomatognathic system. And that, of course, that expanded into a connection. We talk now about the oral systemic connection, the whole body perspective, which, by the way, we now have, I think, a significant amount of research about things that for many of us we knew intuitively for a very long time, that the mouth was actually attached to the rest of the body. Now we have a lot of evidence to prove that as well. To expand into the mind-body connection, recognizing that the way people think and their emotions, the way they feel, has an impact on their health. I always remember a patient who I saw for several years. She was a lovely young woman, but she showed up about once a year with an acute periodontal infection. And there would be a perio abscess, and we would treat it and help her with it. And then she would be fine for a really long time. And then she would show up with an acute infection. And it took us a little while to recognize the fact that she worked for National Public Radio. And it seems as though these infections showed up concurrent with the fundraising drive that they had every year. It took her a while and took us a while to recognize what was happening for her in terms of the stress that she was under and the pressure that she put on herself. And that was one of the things that also helped me understand the place that relationship plays in health, in the health of our patients, that our ability to, the connection we had with each other had a powerful influence on our ability to help people make good choices about their health, and that expands into their spiritual health, that there's a way in which none of this is separate from any other part of it. That's a much broader perspective than what I came out of my education thinking about. I came to understand that what I wanted to do was to go beyond education I wanted to influence. I wanted to influence the way people think about health. I wanted to influence the way people feel about their health. And of course, I wanted to impact and influence the way people act, the actions that they take to become healthier, to stay healthy. And gradually, I began to see myself, as many of you in this room do, as partners in health with my patients. But unfortunately, what I realize is that to a great degree, our patients frequently don't come to us that way. They come to us as fixers of teeth. They see us as fixers of teeth, not partners in health. And through a lot of conversations and getting to know people over the years, I think in many cases, we are able with some of our patients to have them come to see us as partners and as trusted advisors when it comes to their dental health. But they still don't always see us as partners in health and trusted advisors when it comes to their overall health. What I've come to understand is that there's an invitation that's missing. That one of the challenges we have, if we want to have an impact on the overall health of our clients, if we and our patients, if they want us to be a part of that, we need an invitation into that conversation with them. If we jump in too quickly to making recommendations about their overall health, we are more likely to meet resistance. So we need that invitation. How do we get that invitation? When I think about all of the ways in which our patients are influenced when it comes to health, all of the input that they have from such a wide variety, everything from their medical doctor, their naturopathic doctor, their myofunctional therapist, to Facebook and the mom group that they're on, the neighborhood group that they're on, I don't know, the comics. There's a way in which with all of that input, with all of those, everybody having an opinion about how they're supposed to take care of themselves, it strikes me as interesting that why would we be surprised when they don't know who to trust? Why would we be surprised when they shrug their shoulders and they get confused? Because sometimes the information is conflicting information. Sometimes it's not actually conflicting information, but it comes from various perspectives that many people really don't know how to navigate. So why should they trust us? One of the things I would ask you to think about is who you trust. How do you decide who to trust about decisions about anything in your life, whether it's about your health or about your finances or about how you raise your children? How do you make decisions about who you should trust? When I ask myself that question, when I ask myself who I see as a trusted advisor, there are two criteria that came up for me. I think they need to know their subject, and at least as important, they need to know me. In order for me to feel confident in an advisor, I want that person to know what it is they're talking about. I want them to be well informed. I mean, I don't think, for the most part, we don't tend to ask someone who doesn't have children for advice about raising children, for example. Although I will say that the time I knew most about raising children was before I had it. I would want to go to someone who had raised children. But I also want someone who knows me, who knows my values, who knows how I want to raise my children. And so I want that person to have a sense of who I am and what's important to me. I think that's the way a lot of people make decisions. We all have challenges in regards to our health. I'd like to ask you, if you would, if just for a second, what's a change that you think would be good for you? A change you think you should make in your life that would contribute to your health? A change about your diet or your exercise or your sleep or your rest or your meditation, your relationships. Some change that you think you probably would be good for you, but you haven't yet made. I'm not going to ask you to share what that is, but I am asking you, can you indicate in some way, give us a thumbs up or raise your hand or whatever. And if you can think of one thing that would be good for you that you haven't yet done. There's a thing that's called reactions that you can click on that. Can anybody, I see 3 participants have raised their hands. What about reactions? Anything at all that you could do that would be good for you that you haven't yet done, something you could do more of that you're already doing or do less of that you're already doing. Martha, what are you seeing? Are you seeing any reactions or?
I'm not seeing anything in the chat, but I am seeing, oh, nope, somebody just put go to bed earlier, but a lot of people have raised their hand clearly that they can think of things. And, you know, this health stuff, we're in step with our clients. We're, you know, it's not like we can be an advisor, but we're all on some path ourselves too.
Exactly. Those of you who can't think of anything, if you need any, I have some extra things that I could recommend to you that are a few of my own personal things that, yeah, I think that that when we think about our own health, most of us can think about things that we could do. So we come as fellow travelers to this conversation with our patients, right? We don't come as the experts. We don't come as the people who have the answers for them. We come to it as fellow travelers. And when we do come to it as fellow travelers, what we get to bring is we get to bring our compassion. We get to bring our empathy. We get to bring our humanity. One of my favorite quotes was from Rachel Naomi Remen's book, Kitchen Table Wisdom. She quoted the psychologist Carl Rogers, who said, before every session, I take a moment to remember my humanity. There is no experience this man has I cannot share with him, no fear I cannot understand, nor suffering I cannot care about, because I too am human. No matter how deep his wound, he doesn't need to be ashamed in front of me. I too am vulnerable. And because of this, I am enough. And because of this, I am enough, not in spite of my humanity, not in spite of the fact that I'm on a journey of becoming healthier, just like everyone else is, but because of that. And that's what allows me to sit side by side with a patient, rather than to be in that position of the expert standing above them. I can sit side by side and say, yeah, I get it. I get it. It's not always easy. The late Dr. Bob Barkley said that we have to earn the right to influence our patients. He said your dental degree gives you the right to practice dentistry, but we have to earn the right to influence. So how do we do that? How do we earn the right to influence? How do we get that invitation? How do we get that invitation that we need to be invited into that process? Well, I said that there is something that you already have in your practice that I think is a powerful tool. I don't think there's a dental practice out there that doesn't use some kind of medical history for our patients. And we use it for every patient. It's pretty much part of the standard operating procedure of every dental practice I know of. It is a powerful tool, and it's one that was designed to be very efficient. It has little boxes that people can check. They don't have to write anything. So it's designed to be, we all know that there are patients who really take a long time to finish filling it out. I understand that. But generally speaking, it is a very efficient tool of gathering a lot of information about the patient's past medical history. It's an efficient tool. But I'd like to suggest that it's also very often a missed opportunity. This tool is one that has tremendous potential in your practice, that has the potential to help you understand not just the surface things, not just the tip of the iceberg, not just the quick responses, the check marks, the list of diseases that a patient has, but also the underlying attitudes and beliefs that go with that. The patient's experience of the disease or conditions that they have, their understanding about it. That health history is an opportunity for you to learn so much more than just what gets checked off in those boxes. If you can begin to see it as a dialogue, as opposed to just a data gathering tool, which is the way we were taught to use it in our clinical training. That it's a tool for gathering information, but that it can also create a dialogue that helps you to get to know your patient in a different way. It can be used as a tool for co-discovery. I don't suggest that you throw it away. It's a wonderful tool to use as a co-discovery tool. And co-discovery is something that's been talked about like a lot in dentistry, and is frequently seen as a way of helping patients see what we see clinically. And I think as a strategy in that way, it's a very useful tool. But I'd like you to think about co-discovery really as more of a way of being in relationship with patients. It's one that says it's a process in which I learn about you as you learn about yourself. If I sit down with a patient and I might say, well, I know you filled out this health history form, but I'd like to take a few minutes and just have you share a little bit about your health with me. It's an opportunity for me to learn about, again, not just the diseases they've had, but their experience of that, about their attitudes and about their beliefs about that. But it's an opportunity also for the patient to learn about themselves. And any of you who participate in a process like this know the magic that comes as a patient realizes things as they talk about their health. They're learning about themselves as they talk about it, as they hear themselves speak. Sometimes, Dr. Rachel Remen says, sometimes as we speak things out loud, we hear ourselves for the first time. And it's in that space between I'm learning about the patient and they're learning about themselves. It's in that space in the middle where those two circles intersect, where there's a powerful connection that can happen. Again, if I can show up as a fellow traveler with my patient in that process, there's a connection. There's a level of trust that can come out of that learning process. That is a powerful connection and a powerful basis for becoming a trusted advisor. So learning to ask questions during that process that take you beyond just the data is an important part of the process, because the questions we ask shape the conversation. The questions we ask shape the conversation. Look at the questions on the typical health history in a medical practice or in a dental practice. I always think about, we call it a health history, but to me, it's a disease history. There's very little in there that has anything to do with health. The focus is on disease. Now, don't throw it away, but follow up with, I see that you filled out this history and I'd like to talk with you about that, but I wonder if we can begin by can you just tell me a little bit about your health in general? How healthy do you think you are? If I start with health, I'm more likely to have a patient go to health. If I start with disease, we'll go to disease. If a patient says, well, I think I'm pretty healthy, it's wonderful. What do you do to take care of yourself? I want a focus on health, not on disease. The questions you ask shape the conversation. And by the way, that's not just with new patients with a health history on new patients. It's with every single interaction, with every single patient, with everyone on the team. When somebody comes in for their routine hygiene check, I have what I think of as key questions. I've come over the years to identify as key questions, because to me, they're questions that open a conversation, not ones that shut down a conversation, but that open a conversation. So instead of asking any changes in your medical history, I like to ask, how has your health been since I saw you last? I'm going to get the information about the medical history. I'm going to go to that question after the fact. But if I ask, how has your health been? I might get the answers to that. Well, I've been sick, or I had some surgery or whatever. But I also might get, I stopped smoking, or, well, since the last time I was in, I've been really exercising on a regular basis now. I'm really feeling good about that. I've been meditating regularly. I've been praying. I feel better. I would hear something about health, not just about disease. And instead of asking any problems that you want us to pay attention to, I've asked, what have you been noticing about your teeth recently? What are you noticing when you brush or when you floss? And yeah, I might get, well, I notice some bleeding here, or I'm noticing some spaces in my teeth. But I also might get, I've been noticing that it's really so much easier for me to floss around that tooth that we did a crown on. We have an opportunity to shift the conversation, the focus of the conversation, to health. If you want to be seen as a partner in health, then moving the conversation in a direction towards health is going to be so much more powerful. I can ask about how their vacation was. I might make a note of that, but also I can ask, how have things been going with those changes you mentioned that you're going to do in your diet? If the last time they were in, they talked about some step they're taking to become healthier, I want to go back to that as how I begin my process with an ongoing patient, rather than falling into some of the old habits that are focused either on disease or on the dogs or the trip to Disneyland or whatever, which are all fun. But there's an opportunity in those situations that get missed. See, the truth is, everyone has a story. And if we can take just a little bit of time to understand that story, to explore with them, to understand something about their attitudes about their health, to understand something about their motivation, strategies that they employ to help themselves become healthier. If we invite them to share their perspective with us, they're going to be way more willing to hear our perspective. I want to hear about their hopes. I want to hear about nobody comes in hoping to have a crown done. I'm talking about hopes. I remember a patient who told me she was in her early 70s, and she told me that she had started doing yoga. And I asked her, that's wonderful. What prompted her to do that? And she said, I want to be able to climb Mount Rainier with my grandchildren. I want to be able to climb Mount Rainier with my grandchildren. This is a person who has high aspirations for her health, who has hopes and dreams for herself and for her children and her grandchildren. So one of the things that I always ask whenever a patient shares anything they've incorporated into their health, they've quit smoking, or they've changed the way they eat, or they've changed their exercise, or they've done anything at all to become healthier. There are two questions I'm always going to ask as key questions. And one of them is, what prompted that change? What made you decide after all this time or whatever to make that change? Because that's about motivation. And if I want to become an agent of change, if I want to help them make changes in their lives, then I want to know how they've been successful in the past. And I also want to ground them in their success, that they know they can make changes. And the second thing I want to know is, what did they do? How were they able to do it? What strategies did they employ that will help me help them employ strategies for change, and also remind them that they know how to do this. They know how to become healthier. So it's about asking the questions, and it's about generous listening. And generous listening is really about bringing our curiosity into the conversation. It's about coming with a belief that this patient has something to share with me that's important, something that will help me help them better. So asking questions are a way of opening things up. And generous listening is a way of getting feedback about how you're being heard. So having said that, I think this might be a good time for me to do some generous listening and to hear if there are things that are coming up for you. Martha, are there any questions that have been coming up in the chat box so far from anyone?
Not so far. I think everybody's just intently listening. And everybody might be wondering how you find the time to do all this, because you have to slow down.
What? You
Yes.
mean like a dental practice might be busy, Martha?
Right.
Like you have a schedule that you're trying to keep on?
Right.
Yeah. You know, one of the things for me is that if we're going to be partners in health, I believe that partnering does, yes, take a little more time, or at least it seems like it takes a little bit more time. I will tell you that over all the years that I've practiced, and it's been over 50 years in dentistry, one of the things that I really came to notice is when I thought I was being most efficient, I was generally being less effective. And in the long run, I ended up taking more time, spending more time, understanding what the problem was, and I was beating my head against a wall, giving information, more information, and not getting enough feedback about how my information was being heard. I'm curious also if others of you have questions that you've found are helpful in asking patients. I've shared some that I have found it helpful. I'm wondering if there are questions that you have found helpful.
Well, we're also helping them connect the dots for themselves when they can hear themselves talk.
Yes, that's the place where one of my favorite things that I hear a patient say, one of my very favorite things, is when somebody says something and then says, well, you know, I never thought about that before. Because that to me is an insight. That's that patient looking inside. I remember a woman who told me one in a preclinical interview, which was just a knee-to-knee health history. I would just sit knee-to-knee with the patient and ask the questions that were on our form. And in doing that, I would begin to ask some other things. Oh, well, how does that history play a part in your life? Or How did you come to doing that? And one of the things that this one particular woman told me was that she had been a smoker. That's on everybody's health history form. And she said she had been a smoker, but that she had quit smoking. And I asked her how she did that, what prompted her. She said, well, it was when her daughter was born that she realized that she didn't want to be a smoker around her daughter. And later in the conversation, I asked her a question. She mentioned something about that she was taking tap dancing lessons. I asked her what she was doing to keep herself healthy. And she said, taking tap dancing lessons. I said, how did you get into tap dancing lessons? And she said, well, my daughter was taking tap dancing. And she said, so I figured I could spend time with my daughter and also get exercise myself and set a good example for my daughter. And as she said it, she said, wow, I guess my daughter's really a good influence on my health, isn't she? I said, yes, that's a powerful insight for her to have as a mom and as the model and as the example she's setting for her child. Those are the kinds of light bulb moments that light up my day.
Here's a good light bulb moment too, Mary. Someone said approaching patients from a healthy standpoint is so much more rewarding than approaching them from a disease state.
Approaching them from a health, it's so much more rewarding.
Yes.
I mean, it doesn't it make your day better? That's a light bulb for me. Yes. I mean, we have to deal with disease. It's not like we don't deal with disease. That's a part of it. But the health, moving towards health, is more enriching. It's positive. It's moving forward as opposed to staying in what has been. I've heard it said that Bob Barkley used to do with patients. He would say to his patients, you know, whatever he found, whatever disease he found, he would say to his patients, you know, Mrs. Jones, if I had taken x-rays of you every 6 months since you were born, so we wouldn't have done that. But if I had, and you're what, 40 years old, if I had done that, I would have 80 sets of x-rays. And if I stacked them one on top of another and then thumbed through them, he said, I would have a video of the health of your mouth for the last 40 years. And we would be able to see the way your teeth came into your mouth and the health as they came in is healthy. And then to the degree of breakdown that you have today, we would see that movie. And then he would say to the patient, you know, there's nothing we can do about that movie. That movie has already been made. But if you'd like, you and I working together can create the movie for the next 40 years. Is that something you'd like to do? That's that focus on health. That to me is so much more rewarding than the focus on disease. What other thoughts are coming up, or questions or insights?
We do have a question about, can you say more about how to set this up in a practice, not with the patient supine in the hygiene chair?
Yeah, that idea of standing over someone doesn't lend itself well to partnership, does it? When we think about partnership, we don't think of somebody standing over us while we're lying back in a very vulnerable position. If we're eye to eye, if we're knee to knee, if we're face to face, we have there's more likely going to be that partnership, isn't there? What about, by the way, you can unmute your microphone and ask a question. You don't have to type if you don't like to type. You have options.
Someone does a new patient experience with a series of 3 to 5 visits gathering data. They've set aside a lot of time.
That's a lot of time.
Yeah.
That's a lot of time. And here's the thing about that. You know, there are people who would say, well, nobody would want that. And yet, obviously, you get patients who are willing to do that. That was certainly Bob Barkley's model, was for more than one visit. And then here, the thing to me about that is, and my experience is, if that process is about my process as the dental care person, then I think I might meet with resistance. If what I'm saying to a patient is, you're going to have to come in 3 or 4 times in this practice in order for us to see you, I don't think that goes over very well. But if that process is about the patient's process, I remember one time I had a patient who I was told was a very busy attorney. And I said, how do we know that? And they said, well, because his secretary told us that when she made the appointment, and his wife told us that when we confirmed the appointment, and he's a very busy attorney. And so I went into my mode of, oh my God, this guy's a driver and I'm going to have to move him through here quickly. And I brought him in, I sat him down and was like, okay. I was going through the health history with him. And I would ask him a question or two, and then he would expand on the question that I was asking him, something about some condition or whatever, and he would tell me more about it. And I'd said, well, yes, well, I want to make sure we're making good use of your time. And finally he stopped me and he said, Mary, what's this about time? And I said, well, you know, I know how busy you are. I wanted to say, I know you're a very busy attorney, but I didn't. But I said, I know how busy you are, and I want to make sure we're making good use of your time. And he looked at me and he said, Mary, this is about me. I have time for me. And I'll never forget that statement, because it really made me realize that if this was about me just going through my list and not listening to him, and I just was making him jump through hoops, then it wouldn't have been a worthwhile experience for him. And it also wouldn't be a worthwhile experience for me to try to drag people through a process. But when the focus is on them and they are leading the process more than I am, I think their people are willing to give that time to themselves. What else? Nobody's going to turn on their microphone. Come on, somebody's going to turn on their microphone.
Mary, I'm the one who mentioned about the new person experience. And I have had very good success with that over my 50 plus years of practice and building that up. I started with Dr. Pankey walking on the beach one day, and I said, Dr. Pankey, I don't think I can do that in my hometown. It's only a small village. And he said he started in Newcastle, Kentucky. So he started me on that new person experience, and I have very good success with that. I don't think that I can remember a person who didn't want to go through that. But what I do start out with is talking about goals. One of the first questions I ask a new patient that's not in pain is I'll ask him, what are your goals for your mouth? And let them and I need to shut up. It's hard, but I don't want them to tell me what they think. Barkley said a lot of times we talk too much. And he also said that if you let the patient who hasn't thought much about their teeth, you've got to get them to thinking about their teeth and their mouth and what they want to have happen in it. And so I began that very early in the new experience and have a time once they agree, if that's what they want to do, is to keep their teeth for all their life. I said, okay, well, let's talk about this experience of making goals for your mouth. And I have borrowed from Lauren Miller and Harold Worth and all of those people back then, because I happened to be coming through dental school then and walked with them. But they helped me orient the patient towards what's the value of your mouth to you.
Yes.
What can you do to what do you really want to have happen, and let them have the floor.
And that's
They
when,
all will
yeah,
always say, wow, this is different. I've never been
exactly.
treated.
And because of that, if we try to make recommendations for care without a context for them, right? Their goals are the context, or should be the context for recommendations that we're going to make. And
Right.
if we don't have that, if we haven't learned anything about their goals, then it's going to be very difficult for us to create a context for any recommendations that we make. It is in my experience, that is the missing piece in many of the conversations with patients. It's that we haven't yet established where we're going together. That simple example of that Dr. Barkley used of the x-rays isn't, to me, to say to a patient, I'd like to make that, you and I can make that movie together. Is that something you'd like to do? And if we get agreement from the patient, yes, I'd like to work together with you to make this new movie. That's not specific goals in the way we would typically identify them, as in, I want to have X number of teeth left, but it begins to create a context. I love that you asked that question about goals. I'm wondering, are there other questions that other people ask that you find helpful in moving that conversation along?
I like when instead of having an expectation, the doctor having expectation, or the patient feeling that it becomes more of a mutual agreement. So there's a buy-in on both for the doctor and the patient, that they come to agreement that they want to do something together, versus maybe the doctor or the patient having an expectation something's going to happen, but it's more of a mutual agreement. So there's buy-in on both sides.
So how do you do that? How do you create that mutuality of the expectations?
Well, I think that, the way that I've done it is just saying, expectations can be one-sided, and, we might uncover a tooth and we don't really know what's there, that's underneath there. So can we be open to the idea of it could be great, or maybe it's going to need a root canal, but I don't want to set you up to say that it's going to be perfect, but I want to come to a mutual agreement that we work together to come up with the best solution.
It's just a great example of, we don't have to come into the conversation as the expert who is supposed to know everything. And I think that's one of the things that makes, I think that's one of the things that makes dentistry sometimes so challenging and so intimidating and stressful over time. Somebody said earlier, this focus on health is a less stressful way of being in relationship with people, a more joyful way. Because if we can come to the conversation as fellow travelers, as, yeah, things are going to happen. I don't have all the answers. You don't have all the answers. But if the two of us work together, we can likely get to some mutual agreement about what it's going to take for this particular person to achieve whatever the level is that they aspire to in terms of their health. And it is individual for each person. It's not something that we can just set out. The biggest challenge for us, somebody said the biggest challenge is shutting up. I agree. It's letting go of our assumptions. The assumption that I know what's best for you. And I think our clinical training leads us to believe that we're supposed to know what's best for the patient. And Dr. Remen says, you may know what's best for the patient, the disease the patient has, but that's not the same as knowing what's best for the patient. If we can let go of our own assumptions about what we're supposed to do, if we can let go of our judgments about how healthy this person should be based on our criteria, if we can let go of our solutions to their problems. And I'm not saying that, I really want to be clear, I'm not suggesting that there isn't a place for solutions, that there isn't a place for our expertise to show up, for information to show up. But if we could slow ourselves down a half a step, right? A half a step, you will be amazed if you can just slow down that inclination to jump in with the answer. You will be amazed at the elegant solutions patients come up with to their own health challenges. You will be amazed at the creative ways that people have. The reason they're elegant is because they're their solutions, not your solution. That the one that I would give them. You know, I was taught to say, if a patient says, I don't have time to floss, I would say, well, don't you watch the evening news at night? You can do it while you're watching the news, right? That's about me having the solution. I always have to have the answer for them. But if I learn to sit back and say to a patient, well, it sounds like you're very busy. Is there any time at all during the day that you're sitting where you feel like that you could do that easily? You know, I can always go to, how about the news later on if they don't come up with it? But when I ask the question, is there a time? They usually have a better answer than the nightly news. They usually come up with a better solution because it's their solution. You know, I think one of the things that our clinical training teaches us is that our job is diagnosis, and that's a really important part of what we do. And that what we can do is we look at what is and we look at what's possible. We're really good at that. We can see the solution to the problem as we're seeing the problem in many cases. And that's something that we take a great deal of pride in. But I said, Dr. Rachel Naomi Remen says, doctor, knowing what's best for the disease your patient has is not the same as knowing what's best for your patient. You know what's best for the disease the patient has, but what you just described of, and what I've been hearing on the feedback is that when we come together, when we sit eye to eye, we can come to a much more elegant treatment plan, a much more elegant solution to the problem, a much more comprehensive plan for health, not just a treatment plan, but a plan for health. That's different. That's about a mutual agreement about going forward in a certain way, a mutual agreement to accomplish some things, because what's in between the what is and the what's possible, what's in between that is to what does the patient aspire? What are their goals? And they may not be clearly defined goals, but it's where are they on a spectrum of health, of disease versus health. Let's face it, if a patient comes to us in pain, what we see as possible, whether it's extracting the tooth and replacing it with an implant, or whether it's crowning the tooth or whatever it is, what's in between that is aspire. What does the patient aspire to at that point? Get out of pain, right? They don't have a big picture. So if we can meet them where they are and recognize that what they aspire to now in this moment today is not the be all and the end all of what's possible for them, but it is a key element in any kind of recommendation that we would make for them. And so, you know, if it's a patient talking about some physical pain, what are your thoughts about how you're going to deal with that shoulder pain? Before I jump in and say, well, you know, it might be your jaw. Let me tell you about the physical therapist I see. What are your thoughts about how you're going to deal with that shoulder pain? Give them an opportunity to think it through and articulate what their ideas are. Asking the question about anything we're going to make a recommendation about, especially if it's anything that's a little bit outside the realm of what's considered, what's traditionally seen about dentistry, is would you like some input about that? Before I jump into it, would you like some input about that? Would you like some help with that? And if I do make a recommendation, when I'm doing an exam, an initial exam on a patient, if I'm seeing bleeding or if I'm seeing plaque, sometimes I hear the dentist say, well, we'll get the hygienist will fix that. The hygienist will help you with that. Just asking the question, would you like the hygienist to help you with that when you see her? That puts the hygienist in such a different position when they're having that conversation. So I understand from the doctor that you'd like to have some help with being more effective at removing the deposits that are around this tooth on the lower right. That's a different conversation. If I do make a recommendation to a patient, to say afterwards, is that something you'd like to try? If I show somebody how to use some kind of an implement, whether it's floss or whether it's something dietary or whatever, is that something you'd like to try? Is a way to get some kind of commitment from the patient that they're in this with you, that they're in the process with you.
Mary,
Yes.
I think you're absolutely right on track here, because it's been my observation that we dentists are world class at answering questions nobody asked. And the notion of maybe asking a question for guidance, I know it means moving the locus of control from us to the patient, and that's risky, but that's not our default mechanism, and working on it is worthwhile. So thank you for this.
You're welcome. I agree with that. It's not our default mechanism. And one of the things that I have learned over the years is that to the degree that I'm really able to, this quote from Albert Schweitzer has been a part of my life for a long time. And I really believe it, but I forget it. I lose it, that patients carry their own doctor inside. Every one of us has opinions and ideas and knowledge about our own health. That is this doctor that's inside. And he said they come to us not knowing that truth. We're at our best when we give the physician who resides within each patient a chance to go to work. That's our job. That's the helping people become healthier, is that willingness to not give up control, to share control, to really truly partner with someone on their journey toward health. And the question about time, I'd like to suggest you have all the time you need. And I know that doesn't mean you have time in today's schedule, but you do have the lifetime of your relationship with your patient. And if every conversation that you have empowers that patient a little bit more, helps them get a little bit clearer about their attitudes, their beliefs, their biases, their barriers that they see for themselves. If every single interaction, or maybe every other interaction, they get some kind of an insight over time, over the lifetime of your relationship, you are becoming that trusted advisor to your patients. You will find them coming to you with questions, asking you about what their physician is recommending or something that they saw online. We want them to come to us with those questions about what Dr. Oz is talking about. You have the lifetime of your relationship with your patients to do that. That's what I think it is to be a true partner in health. That's what it is to truly become that trusted advisor with your patient.